So, many would say that the standard for ALL still is, standard chemotherapy, or if you have Philadelphia chromosome positive ALL, to get chemotherapy plus a tyrosine kinase inhibitor, and you can choose your one you feel more comfortable with, either imatinib, dasatinib, or ponatinib. Now, I would argue that the standard has already moved beyond that. You can see, based on some of the data that's presented at this meeting today and been reviewed by a lot of our expert presenters, that as we've incorporated these new drugs, inotuzumab, blinatumomab, and more potent TKIs such as ponatinib, into the frontline setting, the standard of care has really evolved over just the last few years. So in the frontline, I really do think that I would consider it standard to incorporate either blinatumomab and or inotuzumab into the frontline setting for patients with Philadelphia chromosome negative B-cell ALL. We've been doing a regimen of Hyper-CVAD plus blinatumomab that's yielded excellent results. Other groups have shown the effectiveness of incorporating these agents into the frontline setting. For older patients with newly diagnosed ALL, so those patients who are 60 and older, we've been doing for a long time low-intensity chemotherapy along with inotuzumab. And then more recently, in the last few years, we also introduced blinatumomab into that regimen. We've seen more than doubling of the survival outcomes compared to the historical standard with chemotherapy alone. And I think that really is a standard of care now for patients who are older patients with Philadelphia chromosome negative B-cell ALL. And for Philadelphia chromosome positive ALL, I think we have now two studies. We have the DIALBA study showing the effectiveness of dasatinib and blinatumomab. We also have our study from MD Anderson showing the effectiveness of blinatumomab and ponatinib. And I would argue that the standard of care now is actually a chemotherapy-free regimen for patients with Philadelphia chromosome positive ALL. So I think the field has really moved greatly in just the last few years. Historically, for example, Philadelphia chromosome positive ALL was one of the most aggressive types of leukemia, one of the ones with the worst prognosis, and now it's one of the most curable, treatable forms of leukemia, and that just shows how much we've advanced the field in the last few years with these new drugs and using them in combination in the frontline setting.